I think it's changed. I mean, I think there's this culture that's kind of come about through advertisements on radio and TV and what have you that, treat your low T type of thing. And so it's certainly become something that's talked about a lot more these days, certainly in the last 10 years or so. And the recognition that we've known for really 20 or 30 years that testosterone levels do decrease with age. Again, how much of what happens in normal aging is due to that low testosterone, how much can be reversed from that testosterone treatment, I think is what this study was designed to show, and it showed just modest benefits. Well, there's a number of options. These are topical gels that get put on the skin and you absorb testosterone through the skin. That seems to be the best, not tolerated, but probably the easiest way to treat. Testosterone can be given by injections as well. There are pellets that can be implanted under the skin as well. So there are a variety of different ways of treatment. I think most men tend to prefer the topical gels. Well, I think one of the things that this study has shown is that there are some benefits. And I think we would presume that NIH would then support a much larger study looking at the risks. Again, we don't think there's a major risk, but a larger study would need to be done to truly prove that. And so I think that would be sort of the next step. I think we're close to saturating with the possibilities now. There are gels, there are injectables, there are pellets. Whether there's going to be any oral form is not clear because at least the oral forms at this point that have been available up to now have had some liver toxicity so that they've not been used. Whether some new oral form comes out over the next few years that does not have liver toxicity, I think that's certainly a possibility, but I haven't heard of any yet. But just like with any kind of laboratory abnormality, you can have varying degrees of this abnormality. You can have low T or very low T or zero. I mean, it can be all the way down as far as you can go. So that there obviously are various grades of deficiency, and they would respond differently. Oh, if, for example, if you have the normal range of 300 to 800 and somebody is 275, that person will have less symptoms of testosterone deficiency than somebody who has a testosterone of 20. And that patient at 20 will respond much better than somebody at 250.